Hi there, my name is Sarah Hormachea. I'm a registered dietitian and a diabetes care and education specialist. I'm logging in today to talk a little bit about insulin vials and syringes. So, syringes and vials were the original way to prescribe and use insulin at home. While a lot of people are switching over to insulin pens because they're easier and more widely available by insurance, there are still people that prefer to use syringes and vials. You'll also need to prescribe vials if you have a patient using an insulin pump. So in this video today, we'll talk a little bit about how to use a vial and syringe and some of the more common issues that I see folks run into when they're using a vial and syringe. So I have with me today my vial. I also have with me two different insulin syringes. So I have a 50 unit syringe, a 100 unit. They also make 30 unit, and they also make a special type of syringe for insulin U500, but we won't talk about that today. In addition to having different volume sizes, they also have different lengths and gauges of the needle. So you can do a very tiny needle, 6 millimeter with a 31 gauge, or you can do a lot like longer and thicker needle, 12 or 12.7 with a 27 gauge. And it just totally depends on your skin and your preference and the amount and volume of insulin. So if you're doing a very high dose of insulin, a longer needle, a bigger gauge needle might feel more comfortable just for that higher volume. So in order to provide instruction on how to use an insulin syringe, you'll want to instruct the patient to take off the orange cap. There's also a protector on the plunger, the top of the plunger, so you'll have them take that off as well. And then anytime we draw liquid from a glass vial or a glass container, we need to displace that volume with some air. So let's say you've instructed your patient to take 50 units of a long-acting insulin. You will pull back, you'll have them pull back on the plunger to 50, right, to draw 50 units of air. And then they will take their vial, they'll insert the syringe into the top of the vial and plunge the air to create some pressure. So once that pressure has been created, you'll instruct them to invert it. And at this point, they may need to readjust their grip on the syringe and the vial. Dexterity and being really flexible is a limiting factor for using syringes and vials. So think about that when you prescribe. If they have poor hand-eye coordination or weak muscles or a hand injury, this is going to be really challenging. So I usually adjust my grip like such, right? So I'm holding the syringe and the vial in one hand, and then I'm going to use my other hand to draw back on my dose. So I'm looking at my numbers on my syringe, and I'm drawing to 50 because that was my dose, but I'm actually going to draw past 50 because I want a little wiggle room in order to be able to get any air bubbles out. So I'm drawing past 50, and then I'm going to plunge any of the air kind of back into the vial. And I think that looks good. So I'm going to remove it and I'm going to plink it a little bit. You can use a pen, right, to kind of jostle the air bubbles about. And it looks like all the little air is at the top. And so I might push the plunger just a little bit, right, to ensure that there's no air. A subcutaneous injection can be given anywhere you have subcutaneous tissue. So abdominal area, thighs, back of the arms, and what we call lower back, upper buttocks. If you have an area that keeps getting used, right? If you see a patient just continuously use one spot, really have them rotate, right? Our skin is at higher risk for poor infusion and infection if they overuse those sites. Shorter insulin syringe needles can go in at a 90-degree angle, but if somebody does prefer longer syringe needle, then they are going to have to use the pinch technique. You could read about the pinch technique on my website on the blog post about vials and syringes. So you'll have them go straight in at a 90-degree angle. Then they're going to wrap their finger around and plunge the insulin into the abdominal area or into the injection site. You'll have them hold 7 to 10 seconds. This just helps with infusion and good flow. And then they can remove. So they shouldn't see any bleeding, bruising, bumps. It shouldn't be painful. Maybe a little itchy, but that's pretty normal. If it hurts, then something is not being done correctly. So it would warrant further investigation. Obviously, some people are a little more sensitive than others. So you might pick an area or help them pick an area on their body that has less sensitivity. All right, so super important that patients receive training on how to use their vials and syringes. Not knowing how to use their supplies is the #1 reason for not starting on their insulin. And of course, we want people to be healthy and successful, so training is key. If you have any questions, reach out to me. I'd love to hear from you. Okay, take care.